Hello, my name is Jennifer Burleigh and I'm a PharmD candidate for the class of 2022. And today I will be going over Rosuvastatin, also known as Crestor. I will begin with a brief overview of Rosuvastatin. Rosuvastatin also goes by the brand name Crestor. It belongs to the statin drug class family. It's used to lower bad cholesterol, triglycerides, and fats and raise the good cholesterol. It's also used to lower the chance of a heart attack, stroke, and slow heart disease progression, and it works by reducing the amount of cholesterol produced from the liver. Now I will go over some patient counseling points for Rosuvastatin. You should take this medication at the same time each day. Swallow this medication whole and take with water and with or without food. Keep taking this medication as you've been told by your doctor, even if you begin to feel well. Do not take Rosuvastatin if you are allergic to any part of this medication. Tell your doctor if you have liver disease or raised liver enzymes. Do not take Rosuvastatin if you are pregnant or breastfeeding. Avoid or limit your alcohol consumption to less than 3 drinks per day, because drinking too much alcohol while taking this medication may increase your chance of liver disease. Take antacids that have aluminum or magnesium in them at least 2 hours after taking Rosuvastatin. And if you miss a dose, take it as soon as you remember, but do not take 2 doses of Rosuvastatin within 12 hours of each other. Some common adverse effects of Rosuvastatin include headache, abdominal pain, muscle pain, nausea, weakness, and dizziness. Some more serious adverse effects of Rosuvastatin include fever, unexplained or unusual muscle pain, weakness, unexplained or unusual weakness, decreased appetite, abdominal pain, dark-colored urine, and yellowing of the skin or eyes. If you experience any of these serious adverse effects, seek immediate medical attention. Next, I will go over FDA-approved indications and dosing for Rosuvastatin. Rosuvastatin is approved by the FDA as an indication heterozygous hypercholesterolemia, and patient would take 20 or 40 milligram oral tablet once daily. For homozygous hypercholesterolemia, the patient would take 40 milligram oral tablet once daily. For primary prevention of ASCVD or atherosclerotic cardiovascular disease, the patient would take 20 to 40 milligram oral tablet once daily. For secondary prevention of ASCVD, the patient would take 20 to 40 milligram oral tablet once daily. And then for patients with high-risk ASCVD, they may require additional therapies to achieve their LDL-C goal, and then referral to a lipid specialist should be considered if treatment goals are not met. Now I will go over formulations and dosing adjustments for Rosuvastatin. Formulations. So the brand name Crestor is an oral tablet and it's available in 5 mg, 10 mg, 20 mg, and 40 mg. The generic Rosuvastatin is also an oral tablet and it is available in 5 mg, 10 mg, 20 mg, and 40 mg. And the Ezelar Sprinkle oral capsule is available in 5 mg, 10 mg, 20 mg, and 40 mg. And then for renal dose adjustments, for mild to moderate renal impairment patients, there's no dose adjustment required. For patients with severe renal impairment, you would start them at a 5 mg orally once daily tablet. And then for hepatic dose adjustments, the use is contraindicated in patients with active liver disease. And then for patients with chronic liver disease, you would start them at 5 mg orally once daily. I will now go over the mechanism of action of Rosuvastatin. Rosuvastatin is an hmg-coa reductase inhibitor that inhibits the conversion of hmg-coa to malevolate in cholesterol synthesis. This inhibition results in an increase of LDL, or low-density lipoprotein receptors, on hepatocyte membranes and stimulation of LDL breakdown. hmg-coa reductase inhibitors also decrease levels of high-sensitivity C-reactive protein, or CRP. CRP is a protein found in the blood that is sent into the bloodstream in response to inflammation. It lets you know whether your body has an infection or is injured. Therefore, high levels of CRP indicate a serious infection. Rosuvastatin also possesses other properties including inhibition of platelet aggregation, anticoagulant effects, reduced inflammation at the site of a coronary plaque, and improved endothelial function. I will now go over the warnings, precautions, and contraindications of rosuvastatin. Warnings and precautions include patients with diabetes. They may experience a small increase in their A1C, and fasting blood glucose has also been reported. Patients with hepatotoxicity, liver enzyme tests should be obtained at baseline and as clinically indicated. And then patients with myopathy. So patients should report any unexplained muscle pain, tenderness, or weakness because this may be a sign of a more serious condition called rhabdomyolysis. And then patients with a history of liver disease and or a history of chronic alcohol use, and patients with also myasthenia gravis because it can worsen this condition. And then patients with renal impairment, specifically in patients with a creatinine clearance of less than 30 because they may require a dose adjustment. And then contraindications for rosuvastatin include patients with hypersensitivity to any part of the medication, pregnancy and breastfeeding, active liver disease patients, and then patients who experience unexplained persistent elevations of serum transaminases. Monitoring parameters for rosuvastatin include monitoring for the lipid levels, and the lipid levels would include like LDL, which is your low density lipoprotein, your HDL or your good cholesterol, your triglycerides, and your total cholesterol. And these should be obtained within 4 weeks of dose initiation to establish a baseline, or again, if there's like a dosage change in the rosuvastatin. Then signs and symptoms of myopathy should also be monitored, and those include like any muscle pain or weakness. And then hepatotoxicity monitoring should also be completed during using rosuvastatin, such as the LFT should be performed at baseline, and then 12 weeks after initiation of therapy, and then again every 6 months after that. These are my references. Thank you for listening to my presentation.